Aloha, everyone. Thank you so much for joining me today. This is Be Fit for Health, and I am your host, Biyanka. And it's another wonderful Sunday, and I'm looking forward to today's show. Like every other show, we have an incredible guest coming on. In fact, he's returning. He was on my show, I believe, a few months ago, and we were talking about animal health. And so today is no different. We're going to talk more about our fur babies and how we can get them to their optimal health. And, you know, obviously they can't talk to us. And so we need to learn how to read the signs and see how we can be better parents to our fur babies. So let me introduce our guest again today. He is the owner of Island Mobile Vet. And he actually studied and majored. It wasn't enough that he majored in biology in school. He actually minored in chemistry and computer science. Like, you know, I guess he had some time in his hands. That's how smart he is. But he also went to med school at Tufts University, where he got his doctorate of veterinary medicine. So, Scott Osgood, are you there?
I am here. Aloha.
Aloha, my friend. How are you?
I am good. We're living the life, you know, in lockdown.
Yeah. Listen, it's, you know, like you and me both, we get locked down with our fur babies. We don't have children, but we have our animals. And sometimes I wonder if that's probably, depending on the kid, right? But depending on the animal too, it's either a good thing or it's not. But,
yes. A lot of my clients are complaining their animals are done with them being home and would like them to go back to work.
Yeah, I know. My animal was looking at me the first time we had our lockdown here. He was looking at me like, why are you home? Like, you're usually in the morning going, I'm going to see you later. I'll be back. And then all of a sudden, I'm not leaving. And he's looking at me like, you're going to go, right?
Yeah. There's nothing like a dog that can pee 6 times a day rather than 3. They don't know what to do with themselves.
Right. And, you know, my brother at home takes care of our dog, Taco, and he goes usually for like 5 walks a day. But you would think he would be thin, but he lives in a very ethnic home, and my mother thinks that he's starving all the time. So this poor dog is a little overweight, even though he exercises 5 times a day.
Well, your show is not long enough for that discussion. That'll be another day.
Yes, I know. Isn't that terrible? I know. There's a lot of things that you and I need to talk about.
It is. A lot of pets are getting a lot fatter on lockdown, and they should be getting skinnier.
You know, it's because their parents don't know how to stop. It's not, I mean, most animals are instinctively know when they need to eat, but if you put food in front of them, they're not going to say no, just like us, humans, right?
Oh, yeah. Yeah, they always think it's their last meal, so yeah, they're going to eat. Just like me. You put ice cream in front of me, it's the last pint I might ever have. I'll just eat it.
Oh, my God. I know. That's terrible. I never was like that, but I'm starting to become that person, too, and it's not a good thing. So putting me in lockdown is not a good idea. Don't do it.
No.
So I know that we talked about, last show we talked about, cats and dogs being overweight. And it was a great show, and I felt like that show was not long enough either. And I know we need to get into this because I know we're going to have a lot to talk about. So this topic was, I wanted to discuss with you, and you thought it was a great idea, is on allergies. And a lot of pets have allergies. And so I guess what I would say is, what is the most common problem that you're seeing now when it comes to dogs and cats? And I know they're different. And when it comes to, like, say, getting vaccinated or when they're for the allergies, because I know humans get shots for, pollen and things like that. So what is the difference between the cat and a dog that's having to get vaccinated for their allergies?
Yeah, well, we don't really vaccinate cats and dogs for allergies like we do with people. People used to get, desensitization shots and all that kind of stuff. And they still do sometimes, but there are other more effective ways these days to sort of deal with allergies. And I would back up a little bit and just say that on a day-to-day basis, I would see more pets with allergies than any other problem. By far, it is the number one health concern that I see on a regular basis. That's what we consider chronic disease, is allergies in pets. I mean, after that, I see obviously vaccines and routine care, but right under that is allergies. I see more pets for allergies than any other medical condition in the book.
Got it. Wow, that's crazy.
Yeah, it's super, super common. And the way that animals sort of express it are very different, and people just don't seem to really know how their animal is expressing allergies, because we always think of runny eyes and sneezing and,
right.
That kind of stuff, which is true in some animals, but that is probably the rarest sign of allergies that we see. Most of the time we're dealing with, in dogs, it would be skin disease, chronic skin infections, rashes, bad ear infections. Your ears are just an extension of your skin. So if your skin's out of whack, in a dog, their ear canals are so deep compared to ours that they get a lot of ear disease associated with that bad skin. So that would be the most common. And then secondary to that would be sneezing and eye stuff and that stuff. But really it's about the itch and the skin because they just express allergies way different than humans do.
So why do you think the foot for dogs, especially, because I noticed not just on my dog that has allergies, why do you think the feet are the most sensitive when it comes to the allergies? I mean, is it what they're stepping on?
You mean the lick stains in their paws and the constant chewing at their paws is just a sign of itchiness. And when you think of, if a dog is allergic to, say, environmental contaminants, and they can be allergic to a lot of things, which we'll talk about. But if we're just talking strictly environment, which means pollen, dust mites, mold, those kind of things, that microscopic stuff that just irritates them. Right. Where on the body is those going to accumulate the most and cause the most irritation if you think about contact? And the number one place is going to be in between the pads on their feet because it doesn't air out, so the pollen's trap in there, and then they start itching. And when the dog puts their foot down, everything sort of seals together, so it's a nice little moist nooks and crannies. And those pollens just sit in there, or the molds or whatever. It just irritates the skin because they're allergic to them. And then they chew it because it itches, and now it's moist, and now it sticks together, so they chew it more because it itches even more now, and it's sort of this vicious cycle that just keeps going. But it's a sign of not necessarily that, the feet are the problem. It really is a systemic sign that the whole body is an issue. And we treat those dogs systemically. We treat their whole body, and we have all these other things that we need to deal with because we know it's going to be a disaster if we don't. If we just treat the feet, which we do in some dogs, if they don't have any other big signs, by clipping hair between the toes, all that stuff, and after they're done going for their walk, you come in, people will wash their feet or baby wipe in between those crevices down there just to remove some of the irritants. And those dogs will do a lot better. But, allergies, just like people, it is not a curable problem. It is a chronic, ongoing problem.
Yeah, because you're probably dealing with yeast and fungus and things like that, too, on top of the allergies that are caused.
Secondarily.
So,
always secondarily, Because what happens in dogs when they are allergic to things is the skin cells start to break apart because the pollens in that irritate the skin. And then the skin cells break apart. And when that happens, the natural barrier of the skin is broken. So the normal bacteria that's on top of the skin then gets between skin cells. And then you're going to get pimples, and you get rashes, and you get itchier, and all that stuff. And that's how animals sort of express their allergy. They don't just have a skin infection. It was caused by something in most cases. And although we have to take care of the infection, and they do need antibiotics and special shampoos, which you can talk about, and all that stuff, the ultimate goal is to stop the original process of breaking down the skin. And that's to control the allergy.
So you can't put mittens on them.
You can. If you did, it would be like torture because they're going to be itchy whether you put mittens on them or not.
I know. It's
it'd
constant
be one thing
looking.
if it was like OCD, but they itch.
And it's so different between a dog and a cat because I rarely see cats, unless they're outside cats, really gnawing at their feet, unless there's something in there that's irritating them. No, they don't. And it's really interesting to me. So what is that? What is it that's so different about their skins?
Cats, cats have the same allergies as dogs do, but they express them very differently. Cats, in a lot of times, will have what we call miliary dermatitis, which are these very small, bloody scabs, almost like pinpoint scabs. Usually on the head and the neck, sometimes over the back and the rest of their body. They will sometimes have these excoriations or these red dime-sized lesions, almost like you scuffed your knee kind of lesion, except it'll be like on their neck or on their thigh. And those are called eosinophilic plaques. And they are a result of the allergy. And a lot of people think that the cat is just licking themselves raw, when the reality is that the plaque came first. Sort of like, Mount Vesuvius, like the lava, just the skin irritated and sort of flushed red. And now the cat is licking it because it's raw. So that's a common expression. Dogs don't get those, but that's how cats like to do it.
Interesting.
Cats also like to have ear infections every now and then. Most of the time, they just have itchy temples right over their eyes, in that area where their hair is a little more sparse. You can see scabs there. They like to have acne a lot of times. They can have very irritating acne. Most of the time, it's just little blackheads, and we don't do a whole lot about it. They can also commonly manifest as soft stools or diarrhea. Cats like to have GI signs with their allergies. And some of that can be food-related, and some of that can be systemically related from other allergies and stuff. So cats are, pretty much with every discussion we ever have, cats are always going to be the exception to the norm. They're always going to do things differently. That's the life of a cat.
So it's interesting because I rarely see dogs throw up through a food allergy or something they may have eaten outside, versus a cat seems to be more susceptible and in response to throwing up to an allergy, because you're talking about GI and the way the cats are, they could have diarrhea.
Absolutely.
But so why is that? Why is the stomach system or the digestive system so differently with cats and dogs?
Well, I mean, they are different. Dogs are omnivores, so their digestive system is set up to process some carbs and meat and all that kind of stuff. So in their diet, particularly the way they respond to allergens, if we're talking about food allergies, is a little different because they have, they're more tolerant. So they can definitely have vomiting, but usually they're going to have diarrhea if they have food allergies.
Right.
And with that, they're also going to have, believe it or not, all that skin stuff we talked about.
Right.
Dogs will do that with food allergies as well. Cats can just have soft stool. They may or may not have the skin lesions.
Yeah.
They may or may not have ear problems. They tend to lick a lot sometimes. Sometimes they'll lick the hair off of their forearms or under their belly. When we're examining cats that, have little issues like that, we're always flipping them over and looking at their belly.
Yeah.
And a lot of these cats are just bald on their belly. And it's a sign of us that they are over-grooming that area because they are disturbed for one reason or another, whether it's OCD, anxiety because they're itchy, or it's because their skin actually itches down there and they're bothering them, or it's because they have digestive problems, maybe linked to allergies. So it's just another weird quirk that cats seem to do that you don't see that in dogs. Dogs don't get bald bellies because they overgrew.
Right.
That's a cat thing.
Well, I rarely ever hear animals sneeze, so I would think that would not be a strong indication for the pets to give us signs that they're having an allergic reaction. It's rare that they're having a sneezing attack, unless they're sick.
Yeah, no, that's true. And a lot of cats will sneeze, but when they're sneezing repeatedly, we don't think allergies a lot of times. We think upper respiratory conditions. There's a lot of chronic viruses in cats and other organisms that cause respiratory signs, snotty nose, watery eyes. Herpes virus is the number one in cats. And herpes, just like in people, is there for life, so they can't really clear it. But when they have stress breakouts, their breakouts are expressed as sneezing fits, congestion, eye irritation, that kind of stuff. And it is a respiratory virus. It is not it's not an allergy in most cases. That being said, I mean, animals can sneeze occasionally because their noses are always to the ground and they just inhale, dust and other things, and they'll sneeze just as an irritation. But it's usually kind of a 1 or 2 time event and you're done with it. It's not like they get congested and boogery and anything like that. If they are doing it more chronically, then, in dogs, again, a lot of times we do start thinking allergies or other issues. And in cats, we think respiratory viruses and stuff. Way before we would just look at that animal and say, oh, your cat or dog is sneezing because it has allergies. Take a Benadryl. That's not really how it works in animals.
Well, That's really interesting to me because we're going to take a really quick short break, Scott. But when we come back, I want to kind of dive into the thoughts behind the animals' responses to, let's say, the food that they consume. Some of the foods that, like how some foods we like, peanuts are usually very allergic to people, and some other foods that are very for the animals. I want to discuss what are the top, let's say, 5 to 10 foods that they should stay away from. Cats versus dogs, and also what are some of the top environmental things that we need to be aware of in our homes so that their environment is safe for them to be able to roll around and not have these mishaps. So when we come back, I'd like to kind of go over those things if that's okay, and then we can dive into the other questions that I have for you for the rest of the show. So hang on tight. Don't go anywhere. And everyone, don't go anywhere. We'll be right back. We're going to hit a 1-minute commercial, and then we're going to be back with Scott.
The Honolulu Club is still here for you. We are providing the safest workout conditions on the island, with modified safe distancing indoor and outdoor classes, large open work floor with clean sanitized machines and free weights. Let the Honolulu Club be your one and only fitness destination. Go to honoluluclub.com and fill out the trial pass today.
Have you heard of microcurrent therapy? If you suffer from chronic pain, arthritis, sports injuries, ligament injuries, or migraines, the electroechoscope can help. This non-invasive treatment system is drug-free and shows no negative side effects. If you are seeking pain relief and want to boost your immune system, schedule a demonstration or consultation by calling Kelly, your microcurrent electrotoxologist, at 485-9697 or follow on Instagram at Kelly's Time. Make your appointment today.
And we're back. Okay, everyone, we're talking about our fur babies, their health and well-being, and we're talking mostly about allergies and what to look for and how to help them get through their allergic reactions to either foods or in their environment. And we're here today with Scott Osgood, the Mobile Vet CEO, and he is talking to me about, what can we do to help our pets with their allergic reactions to many different sorts of things. So, Scott,
yes.
Let's dive into that topic that I was talking about. So let's start with foods. So what would you consider, let's start with dogs. What would you consider some of the allergic foods that dogs usually get a response from?
Sure. So first thing I'd say is when we're breaking down allergies in pets, you cannot tell in most cases looking or getting a history of a pet what their allergy is to.
Right.
And there's really only 3 kind of things they're allergic to. There's food, there's the environment, which would be dust mites, molds, pollen, and then there's insects. So 2 out of 3 of those we can control. So we always sort of start with food. So certain breeds are known to be much more sensitive to certain foods. So we'll say like Frenchies. Frenchies are so popular here on island.
Yeah.
Everybody has a Frenchie. Frenchies are highly allergic dogs. They have a lot of folds and skins and things where things fester, and so they get skin infections easy, and they're super intolerant to certain proteins and stuff a lot of the time. So that's where food comes in. Mm-hmm. When we see animals for food allergies, dogs specifically, and we are sort of triaging them, what we think is going on with the animals, the first thing we think of with food allergies is, when did the signs start? In dogs, typically, food allergies will start under a year old. So if we have early onset of skin rashes that won't go away or keep coming back and ear infections, and they're under a year old when it started, first thing we do is we strip down their diet and we eliminate certain things, and we just go very hardcore for 3 months on food. And we see if we can't rule that out. What we try to do is eliminate all of the common, more irritable proteins in their diet. And that would include the number one allergy in dogs is, guess what?
What?
Take a guess. What would anybody tell you? Probably.
Corn?
Yeah, it's not. It's chicken.
I thought I was going to see. I was going to go for the obvious, and I thought, I'm just going to do something completely different. No, but you're right.
Everybody wants to feed a grain-free diet.
Right.
However, the number one allergy in dogs is chicken.
Makes sense.
The number 2 allergy is, guess?
Beef?
It's beef. Yes.
Hey, I'm getting smart.
We still haven't hit the grain-free market at all. And then after that, it goes wheat, soy, corn, dairy products.
But don't you think that could be because of the way that the cattle and the chicken is being raised? Like if we were to take out the antibiotics and take out the hormones and take out the way that these animals are being cultivated before they're being fed, because animals don't get the best quality of the meat, right? They get the junk part probably most likely in their foods.
They do, and I wish it was that easy.
No?
No, it's not, because when animals react to what they're eating as an allergy source, they're reacting to the meat product or the protein of the meat. That's not necessarily affected by how the animal is raised or anything else. It's those proteins that are in the meat that they're reacting to.
I got you.
Yeah, so that's going to be the same. So it doesn't matter to me if it is a free-range chicken, it is a bougie chicken raised in Manhattan, or it came off the street on the Poly. They're all chickens. And the dog is probably going to react the same no matter what. But that being said, every now and then, because we don't really have all the information all the time, there's a dog or a cat or something that's reacting to what we think is the chicken, and they do change to raw food diets are kind of in vogue these days.
Right.
And the animal gets, somewhat better.
Right.
I would say that's more not the norm, but every now and then there's a dog who really surprises us and does really well on a raw food preparation.
Right.
Chances are that dog is actually reacting to something else in the food, whether it be...
I was going to say really quick, don't forget your thought. Couldn't it be the way that we're cooking it too changes the chemistry of the meat so that the dog can't break it down? Because raw food sometimes is in a natural state, so it may be more alive. I mean, I don't know. I'm just trying to think of the chemistry factor of it. Since you did major in chemistry,
it doesn't change too much on the protein front as far as how your body would recognize it. In other words, you can't cook peanut butter and have somebody not react to it if they're peanut butter allergic.
Okay.
Otherwise, there would be ways for us to process this. But what it does do is when we cook food and we have these bag-prepared foods and stuff, there are other things in that bag that aren't necessarily accountable that can react, which we have to do in order to have stability on a shelf. So those are the kind of things every now and then that might make the difference between a dog who's chicken allergic, we think, and turns out to do really well on a raw food diet.
Right, because it's more natural state.
Yeah. And when they do raw food diets, we often don't give them the same things that are in the bagged preparation. In other words, if we feed a chicken-based diet and it has, some other things in it like wheat and that kind of stuff, and then we're doing a raw food diet, most people aren't going to put wheat in their raw food. They're not going to put sweet potatoes like are in some of the foods or pea proteins. They're usually going to throw in some, spinach, carrots, things like that aren't necessarily very high allergen foods. So the dogs will do better because they're also not getting all the other stuff in the bag.
Right.
However, when I approach it as a clinician, because I'm not really a holistic clinician, I'm definitely more just regular modern medicine kind of stuff for the most part. But I try to do what I can sort of on the do no harm scale. In other words, if somebody wants to try a diet like that, as long as it's the right setting, I'm all for it. We'll try it.
Right.
Because we have nothing to lose. However, my first line of defense is the first thing I want you to do is I really would like you to strip all of that out of the diet. So all the chicken, beef, wheat, corn, soy, dairy, period. No rawhide in the house, nothing like that. And just do a 3-month trial on a better-known, lesser allergenic protein. And in dogs, those would be things like venison, rabbit. There's some ostrich food out there, believe it or not. There's salmon food. There's mackerel food now. So those are the kind of protein sources that I'm looking for just to get us out of that category of the top 5 allergens. Now, it doesn't always mean that your animal cannot be allergic to any of those other things. It's just highly less likely. So we use it sort of as a way of deducing. And if that animal still reacts and I still really feel like it's a food allergy, then what we'll do is we'll put them on prescription dog food for a period of time. And the most common way that we use prescription food now is what we call hydrolyzed. So they take the protein source, which is usually chicken, believe it or not, as much as the allergy is. They take chicken and they have to process it to the point where the proteins are so small that the immune system doesn't recognize them. So they can't have an allergic reaction to chicken if it's sort of pre-broken down, if that makes any sense. The protein size has to be smaller than the immune system can react to. And that makes it a super pure, almost zero allergen food in most cases. So what we do is we just use it for 3 months, and we see if the dog gets better. If the dog gets better, then obviously something's going on with no matter what we're trying to give him. So either he stays on that food or we try other kind of things to get him a proper food that doesn't make him react.
So are you saying like it's like you're methylizing the food, like to a point where the body can just absorb it and not have to break it down and go through the
inflammatory? It's almost like pre-digested. Yeah, because when you eat proteins, proteins they can be 100,000 Daltons long, which is just a really long chain. If you think about a chain of paper clips, that's 10 feet long. That's a protein that you're eating. So your immune system has to recognize that. If you break that down to individual paper clips, it's too small for an immune system really to recognize if you think of it that way, because it has to be a certain size for it to react. So if we pre-break that down with enzymes, you're going to get all the nutritional benefits that you normally would get because you're still getting all the substrates. You just don't really have to do much of the work. But again, it's used as a testing purpose, and if it's really successful and the dog likes the food, sometimes we leave them on it. But for me, I like to use it for a diagnostic tool. If I'm really failing and I really need to know this animal has allergies to food or it does not have allergies to food, that's the easiest thing for me to do, is to make sure that dog gets the purest diet possible, no complications, nothing else, go a couple of months, and do the signs persist or not.
So let me get this straight.
If they go away...
Let me get this straight, though, so that the audience understands. So when a dog has food allergens, and you assume, because testing an animal for their food allergens is very expensive, and nor do you guys really do it, to do that, you need to take the foods that they're consuming out, and you're replacing it with different types of protein just to see if they get a reaction from those, right? Like
Correct.
Okay.
Yes.
So if so if they get a reaction, go ahead. If they get a reaction from that, then you put them on that special prescription dog food that you're talking about.
If I really think that this is food allergy, so, if it's a young dog and he's having all the classic signs, we never could say that a dog that's not allergic to food can't be allergic to venison or rabbit or even potatoes. We are just sort of immediately cutting the odds in the beginning by just cutting out the common ones, because they really are, the ones that I've listed are far more allergenic than some of the other proteins. And we know that the same way we know that peanut butter is highly more allergenic.
Right.
Latex in people is highly allergenic to some people because there are certain proteins that are just more irritable to your immune system.
Got it.
So that's what we're avoiding for. And when it does come to testing, since you mentioned testing, food allergy testing is a very witchcraft science. I don't believe in it. I've never drawn a blood sample to test a pet for food allergies because the kind of response they get from food is a very different antibody response than they get from pollen, dust mites, mold, those things. So they're very different. So we can absolutely blood test for environmental allergies and insect allergies very reliably. Food allergy to me is an absolute waste of money testing, because what you get a list of foods that he's reacting to, which is quasi-science from the beginning when it comes to food. And then what do?
Right.
You have to change the food. So why didn't we just change the food? Save $400.
That's rational.
Do the food trials first, and if you fail, then we'll look into the other stuff. But again, it's a waste of money to do food allergy testing on a dog, because you really aren't doing anything for the dog. You're getting a piece of paper. And when we do the other allergy testing, there are ways to desensitize dogs to pollens and things like that we can talk about like people do.
Right.
But nowadays, there are actually much better ways than actually doing that old desensitization trial. There's a whole bunch of things on the market now that are so much better than that I don't think I've ordered a allergy kit in probably 5 years for a pet to get desensitized, because the other stuff is so consistently good and better that we just don't do it anymore.
Well, it makes sense to me. I mean, just like with as a trainer, and I have people come in and I'm doing their nutrition, I'm looking at what they're eating. And if they're not getting the response, if I'm not getting a response from them after 12 weeks of training them, I'm going to look at how's their body responding to the types of proteins they're eating, the vegetables, if they're eating vegetables, well, how much are they eating? I mean, because we're allergic to things. Like I didn't know when I did my blood work, I was allergic to spinach and I was allergic to really weird stuff, ginger, things like that, things you wouldn't even think about.
Why would you think that?
I mean,
you wouldn't even think.
You wouldn't think about it.
No, and dogs do that too.
Right.
And you wouldn't even think they could be allergic to carrots, but on a rare occasion they can.
Yeah.
But when we add up all the things that they are allergic to, those top 5 by far astronomically outweigh any other protein.
Yeah, that's strange. Beef, chicken. You said dairy. You said corn, right? And what else did you say it was? Corn,
wheat, and soy.
And soy. Okay.
Yep. And in cats have that same list.
Yeah.
But you have to add tuna for cats.
Oh, come on,
tuna
man.
Tuna is a very, very irritating fish oil. It's super allergenic to some animals. So, the foods that we like to use, the ones that we named, salmon is fantastic. Mackerel is fantastic. So everybody likes to lump tuna in with that. Tuna is horrible for cats if they have allergies because the oil itself is just very irritating to them. So we always strip tuna from their diet, whereas the other fish are much better and react much easier with the immune system than tuna does.
My cat's not going to like you very much. Because the only thing that he'll eat out of a can is not just I don't give him the canned tuna, the adult, the human ones that we eat to make tuna fish sandwich. Yeah. But when I go to buy his wet, because my other vet tells me to go get canned food because she wants him to eat more wet food. So the only flavor that he hates chicken. The only thing he'll eat is tuna in crab broth, tuna in mackerel broth, tuna in this. So if I change that, he's not going to eat it. And,
I bet you if you go get him a mackerel-based food, I bet he likes it.
He might nibble at it. You want to talk about finicky. These cats, as all cat owners know, they can be, pain in the behind because they just don't eat it. They'll nibble at it, to smell it, and they'll walk away. And you're like, really? I just opened up a $3 can for you, and you're not going to even eat it.
But let me ask you then, what is your next reaction? What do you do the next day?
Well, you know what I'm doing? I'm leaving it out. I open the can. I put a little bit of chicken broth in it.
And does he eat it?
You know what? He drinks the water. He licks the water. No, but I got smart though. Listen to this. So I'm getting a natural-based wet food. It's called Applause, and it's got a little bit of rice, but mostly protein. I put chicken broth in it, bone broth in it, because I want him to get the bone broth, and I put a little bit of minerals in it so that he gets some nutrients like magnesium and things like that. And then I'll spray a little bit of his teeth cleaning thing, this silver, collided silver, which is just like a few sprays in there. Mix it all together. He drinks the liquid first, so that means he got all the good stuff in. And then if I leave to go to work, and then when I come back, he had no choice but to finish that food.
But he did, correct?
Yeah, because I'm forcing him to.
So this is but this is what I'm saying is that most people's reaction to my cat doesn't like it is to play tin can roulette. Where, they didn't like this one, so I'm going to go buy this one. And then he didn't like that one right away, so I'm going to buy this one. And it's a learned behavior.
It is.
And the cat has trained you to go spend $50 at the store for all of this junk food cans just to find something that he likes. And the problem is it's sort of like going to Vegas. You're not going to win. You're going to spend way more money than you'll ever get in return.
Yeah.
Yeah, so you have to do exactly what you did. You can try to entice the food a little bit better, and then you just got to leave it. You just have to not worry about them tugging at your heartstrings like they're starving to death. Because
their meows are just
fancy feast in square shapes today.
Yeah,
it's not how it works. You're a cat. You must eat your food, and if you don't eat it, I'm going to work, and it's still there for you.
Well, cats,
because you can't let the cat make judgments what's best for it. That's the problem.
Well, the good thing about cats too that you've also taught me is that they're so different from dogs. I mean, and they're very self-sufficient. They can do a lot of things on their own. But when it comes to cat allergies, though, because we went from dog to cat, how do you know if the ear scratching or, because my cat's an indoor cat, so there's no fleas in my house. There's none of that stuff. So what would cause in a household cat, because outdoor cat, you can pretty much guess what it could be out there, the pollen and things like that. But indoor cat, what would cause them to have constant ear scratching or, licking of the paws? What would be their allergens in a household?
It would be any allergy except maybe not fleas. And I say maybe because I have many clients who I am absolutely convinced their cats have flea allergies, and they live on the 24th floor. And the cat doesn't go out.
Right.
And after a few conversations, what happens is Joe Schmo, 4 doors down, has a poodle. And guess what? That poodle is not on flea medication. So every time that poodle walks by their door, the fleas, they're carbon dioxide heat seekers. They immediately know that on the other side of that door, there is another critter.
Got
So
it.
they bounce off, they go under the door, and they go get your cat on the 24th floor of a condo in Waikiki. And then the cat reacts. And so, you never know. However, more commonly, it would be the food, or it would be environmental allergies like dust mites, mold. People have open windows. This pollen comes in. Constantly there's pollen here in Hawaii.
Sure.
So it could be any one of those things. And I will tell you, one of the big differences between dogs and cats with food allergies is, remember we said dogs start their food allergies usually under a year old?
Right.
Then they start their environmental allergies usually 3 to 4 onwards. Cats can have food allergies start at any time in their life. There really isn't a great correlation between the time and onset of allergies in cats and what it could be. So again, cats don't like to read the rules.
Right.
So on a cat, under a year, over a year, 12 years old, all of a sudden itching, it could still be the food. And a lot of people are, I get this response constantly. I haven't changed his food in years.
Right.
You don't have to change your cat's food for him to develop allergies to it. You just don't. It just happens. An allergy is a misfiring of the immune system. It's a miscommunication of something that the immune system should leave alone, and instead it gets all mad and inflammatory about it. And it just shouldn't. Pollens are a day of life. They're all over the place. You shouldn't react to pollens. It's part of living as a human being and a dog and a cat. But yet the body has this miscommunication with the environment, and it says, you know what, I don't like you. And I'm now going to mount a response every time I see you.
Well, should we change our diet, our animals' diets like humans should? Because you know how doctors say don't eat the same thing all the time because you'll develop a inflammatory response to it eventually because your body will think, okay, I'm getting nothing else, so it may negatively respond to it. So should pets do the same thing? Should we be alternating variety of foods for them?
No.
Okay.
We alternate our foods. If we were to eat a fully balanced diet every day, and we knew that this particular meal was fully balanced, whatever that meal is, one particular meal, would we eat the same thing every day knowing we got all of our nutrition from that one set of a meal? We would not, because we want variety, because this is higher learning. This is how we think. A cat or a dog, how many Labradors do you know eat the same dry dog food every day their entire life, and they act like it's the best meal they've ever had every time they eat it?
Yeah.
They just don't think like us.
No,
They don't know variety. They only know what their body is telling them that they need to eat.
Right.
And if they like the food, every time they see it, they'll like it the same, usually. So we don't have to give variety. We do that for our own sake because we anthropomorphize that they are human-like. And they really don't think like that. Cats would eat mice all day long if they were up to their own devices about getting their own food. They would eat the same mouse every day, forever and ever and ever. And they don't go, today I think I'm going to have a bird. Or maybe I'll have a lizard later because I'm not really feeling the mouse today. No, they're going to eat absolutely the same thing every day if they have access, because all they think about is, it's mealtime. It's time to eat. I got to feed my body.
True.
And you can screw them up too. If you are mixing things around a lot, especially with dogs. Dogs are very complacent eating the same food. And if you start switching in certain breeds, like small breed dogs, if you start switching from higher protein foods to higher fatty foods on a daily basis, you can really set them up for big problems like pancreatitis and things like that, because you're changing fat levels and things in their blood, and you can do that relatively quickly if you're feeding them a relatively bland diet one day, and the next day you're giving them, bacon strips and all that other sort of really greasy food garbage. Their body may not respond to that. So you're much better being consistent with a good quality food on a regular basis than you are to play roulette with their food.
Yeah, because I was always told, too, with cats that if you're going to change their food, to mix it with their old food, with the new food. So eventually, gradually, it's like something that their body will get used to. So it's not like a shock to their system to have something different. Yeah, it makes sense.
You never want to. And the main reason for that is you never want to go from a blander food to a high-fat food suddenly. If you're going from a high-fat food to a blander food, you can do it more abruptly in a dog if you wanted to, but we always usually recommend take at least a week to sort of mix it in and change them over if there's no emergency to have to change their food. And that's just for consistency's sake. It's to make sure the dog tolerates the new food. He doesn't have diarrhea on it. Let his GI system sort of adjust if there's a big difference in that amount of food.
So I would say then, what would be the next step? Like, how would you take care of someone who, their pet, if they have high allergies? You've done all the food stuff and you've done the environmental. So how do you now treat?
Yeah.
So is there like a home remedy versus the vet remedy? Is there things that we can talk about?
It depends. It depends absolutely on the severity and how that animal is expressing its allergies, because that changes a lot on sort of how we treat them. And then, of course, there's dogs and cats, which we obviously have to treat very differently.
Right.
When we're treating dog for allergies, if it's a dog that has minor allergies, not so bad, and they are environmental. I'm going to leave food allergies out of this completely, because food is kind of a no-brainer. Like, if I think they have food allergies, we change the food. I mean, there's nothing else to do at that point other than get you on a new food and see how it works. The things that we can't do a lot of things about, which are dust mites, pollens, molds, that kind of stuff, we have to treat that dog on a more regularly chronic basis, because they're always going to be reacting, because we can't eliminate the allergen. So first thing we do in dogs is we bathe them. We bathe them frequently. And we're talking 2-3 times a week for a really bad allergy dog. If they don't have rashes and skin infections, then we just use things like puppy shampoo or aloe and oatmeal shampoo. Something that's not going to dry their skin out too much or irritate them, because they don't, at that point, they have normal skin. They're just itchy. If they have a lot of skin infections and that, then we're going to use antibacterial shampoos for an extended period of time until their skin is clearer, and then sort of transition back to the less aggressive shampoos, because we need to clear that infection. No treatment for allergies is going to get rid of any infection or ear infection that's already set in. So, when we see an advanced allergy case, they usually have skin infections and they have ear infections in between their toes. And we have to separate all that as different problems. We have to treat the infections that are there, and then we have to treat the underlying allergy at the same time, so that we don't get recurrence of the infection. And so we need antibiotics. They know a lot of times, whether it's in a shampoo base or whether we have to give an animal oral antibiotics, it's really important to get rid of the infection. No matter how we're going to do it, we have to clear that overpopulation of bacteria. And shampoos are part of that. If they're not bad, there's a lot of good antibacterial shampoos that we can use. There's a lot of shampoos that have something in it called phytospigamine, and that is a basement membrane in your skin. So your skin has layers, and at the very bottom there's a barrier that protects you from when your epithelial cells, your skin cells sort of flake off, and then your lower skin, which is your dermis. When you have allergies, or when dogs and cats have allergies, that basement membrane is broken up and disrupted. And that's why when we talked about the bacteria getting between skin cells and causing these infections and that's part of the process. So shampoos have this additive in it called phytospigmine, and that is a repair layer for that basement membrane, so to say. So it helps to shield the pet from reinfection as often, because it helps to repair that membrane that's broken down from the allergy.
Where can you get those shampoos?
Those are usually prescription shampoos, because most of them contain other things in them like chlorhexidine and antibacterials. You can just get shampoos that just have that in it and oatmeal in that. Technically, I don't believe they're prescription. You can order them on Amazon and things like that. But it depends on what is going on with the skin, sort of what shampoo will give you, because there's many different kinds of shampoo. There's stuff with antifungals in it. There's kind with antibacterials in it. There's kind with local anesthetics in it to numb the skin a little bit more when they're super itchy. So we have a variety of ways that we can treat them with shampoos, but they have to be catered towards what that animal is currently exhibiting.
Gotcha.
But I always feel like shampoos they're very underdone, because everybody wants to give a pill and they want to do this. And really the mainstay is if we can wash these stuff off our animal regularly, they're going to have less problems. We're not going to fix the problem, but it does lower the amount of hands-on other stuff we have to do for them and the amount of drugs that maybe we have to give them. Yeah,
you don't want to oversaturate their system with more and more pills and other things. Like I think shampooing, and my brother would, after walking Taco home from his 5 times a day walk, he would sometimes put water and vinegar and dip his paws into that, and kind of get the because he gets fungus too, because it's like you said, it's like and yeast, so in the paws. So he tries to dip the a little bit of vinegar, just so they get some of that off, and then wipes it and dries it, and then takes them inside. But in the bottom of it,
it'll help a little bit. But the important thing is really what he's missing is he's missing soap. I mean, the reason we use shampoos and not water rinses and stuff is because of the actions of soap, combining lipids and getting the dirt off, which really is where the pollens are. And stuff. So if you're not using soap as part of your rinsing mechanism, you're really not doing a lot for the dog. So you have to. And that's why sometimes we'll use things, just a gallon of puppy shampoo. A lot of my allergy patients have a gallon of puppy shampoo. And then when they go to the beach and they're bringing the dog home, they'll give them a puppy shampoo bath, because puppy shampoo is super gentle. It's like baby shampoo. So you can do it frequently without worrying that we're going to dry them out, but it still has soap action.
Got it.
Which is so important. It's no different than, us washing our hands for COVID. There's a reason we don't wash our hands with water. You need soap. It has a purpose. So soap is very important in controlling these dogs with their frequent bathing, is it has to be a shampoo because of the soaping action. It can't just be water.
Well, then, if shampoo is a great lower cost and less intrusive format of allergies, so cats don't usually take a bath. So what would you recommend for cats, real quickly?
Not very successfully. No, they don't.
No. You gotta cut their nails.
You do. There's cats are very hard, because in dogs we have all these new alternative treatments that we can do for dogs that work very successfully, and then we have cats. And cats and allergies are really horrible. My cat has food allergies, so she actually takes a hydrolyzed diet. She eats that diet, broken down proteins that we talked about. That's her food, because that's the only thing that sort of keeps her well enough. But at times I've had to put her on drugs because she's so bad. And drugs for cats, we really have a very small selection. We have steroids, which is prednisone, which most people have heard of. Great short-term drug for all allergies. Horrible long-term drug. So it definitely has a benefit in making them comfortable, but we can't leave them on them. So, very short courses and tapering off kind of stuff. So we have other drugs like cyclosporin. Cyclosporin is an immunosuppressive. It's a very potent immunosuppressive. It's what we used to give when people had a kidney transplant to stop you from rejecting the kidney. They give you cyclosporin. So in a very diluted version of that, we give that to cats because it particularly shuts down the allergy arcade, those particular antibodies that are made to, say, eat a kidney. If you had a kidney transplant, you would form certain antibodies against that kidney to reject it. That particular inflammatory response is shut down by cyclosporin. So it's a more specific allergy immunosuppressive, but it's still an immunosuppressive. It's a big drug. So we do use that in cats, unfortunately, when we really don't have any other alternatives that work
Isn't that amazing that we don't have as much for cats as we do for dogs? It's just maybe because cats are always, I think cats are generally a little bit more healthier in the long run than dogs. It seems like they don't have to go to the vet as much, depending on, majority of the cats.
They're a little more self-sufficient.
Yeah.
But the problem really with cats is the way they metabolize things.
Yeah.
Cats and dogs don't metabolize drugs the same.
Yeah.
We have a slew of drugs for dogs that you cannot give your cat or you will kill your cat.
Yeah.
They are absolutely non-toxic to dogs. They're really good drugs. And then you give them to cats, and you're pretty much it's the end of the day. So that's the problem is cats are missing certain vital enzymes for metabolizing drugs. So a lot of the drugs that we use, we can't convert over because they're too toxic to cats. So we're left with this very small arsenal in cats. And there are some antihistamines like chlorpheniramine, which we do use in cats regularly. It seems to work relatively well. You just can't, we look for antihistamines for dogs and cats. You have to get plain antihistamines. Obviously, you can't get any cold sinus combo stuff. And everybody wants to sort of give their pets Benadryl, which is great if your dog was stung by a bee. But Benadryl, the half-life of that is very short in dogs. So you can't really stop a dog's allergy with Benadryl unless you're knocking them out all day long because you're giving them Benadryl every 4 hours. That doesn't work. So we have much better ones, and people can talk to their vets about what is safe and what isn't safe. But again, when it comes to cats, we really, really hope for food allergies because it's the one part of life that
you can control.
Control is food. Yeah, and the other thing we can control is fleas. And here in Hawaii, I will tell you, flea allergies are rampant. And I probably get at least 1 or 2 patients a week that are on flea meds, over-the-counter flea meds, and I'm there to rescue them from their flea allergies. And the reason being is when you use Frontline and Advantage, you've heard of these flea tick drugs that are over-the-counter that you can get for them. They are very slow-kill products here in Hawaii. In other words, the flea will run around the animal for 12 hours, biting the animal left and right, reproduce, and then decide it wants to die. So it doesn't break the cycle. And if your animal is allergic to fleas, they're actually allergic to the saliva of the flea. So the goal is to get the flea not to bite the pet. So you need a quick kill product. And that's why we use a lot of prescription drugs in flea allergies as a diagnostic tool. Because if we give you a prescription drug and all of a sudden all your allergies go away, you just need to use the better flea meds. Problem solved.
Well, on that note, Scott, we ran out of time again, unfortunately. And you got us a lot of information. And guess what? I'm going to actually put this on my YouTube. And on my YouTube, on the bottom part of it, I'm going to put all the listing of some of the things that you mentioned. So I might ask some more information from you just so I can properly put it in there. And then I'll have all of you guys direct you to islandmobilevet.com where he is located at. So if you guys have more questions and you need to get a hold of him, you guys can, or get a hold of me at befitforhealth.com. But go to my YouTube, guys, Be Fit for Health, and you'll see the video here, the interview again, and you can at least get a chance to get more information. But Scott, thank you so much again for coming on to the show. I appreciate you so much.
Absolutely.
All right, Hen, we'll take care. All right, everybody, thank you so much for joining me. Have a great rest of your day. I wish you all the best. Stay safe and healthy. Aloha.